The pulse. We will talk here mainly about the radial artery. This is very important and common because it's a superficial artery. There is bone under the artery. Method of pulse examination. We ask the patient to semi-pronate his hand, slightly flex his wrist. Then the examiner catch the hand of the patient by his right hand by the tips of 3 fingers of the left placed over the radial artery. What are things that we are look for in the pulse? The rate, the rhythm, the volume, the character, and condition of blood vessel wall. The rate. Pulse rate in 1 minute. So the normal pulse rate is about 60 to 100. So if it is less than 60 beats per minute, it's called bradycardia. And if it's more than 100 beats per minute, it's called tachycardia. Causes of tachycardia. Something related to physical state, like anxiety and exercise. Something related to heart disease, like heart failure and arterial fibrillation and shock. We have some drugs and thyrotoxicosis, causes of bradycardia. In physical state, like athletes. In hypothyroidism, obstructive jaundice, increase intracranial pressure. Some drugs like digoxin and beta blocker and heart block. The rhythm. It is even regular or irregular. The irregular rhythm is divided into regular irregularity and irregular irregularity. Causes of regular irregularity: ectopic beat, extrasystole, and premature beat. Causes of irregular irregularity: it is even arterial fibrillation or multiple ectopic beat. Note: multiple ectopic beat is similar to arterial fibrillation, so in order to differentiate between these two cases, we have to do exercise for the patient as hand movement at his bed. So if the irregularity increase, so it is arterial fibrillation, while if the irregularity decrease, this means ectopic beat. Pulse deficit, which is the difference between the pulse rate at the rest and that of the heartbeat by auscultation of the apex beat. Normally there is mild difference between these two rates, but in certain conditions pulse deficit may be more than 10, which means arterial fibrillation, but when it is less than 10, it means ectopic beat. The volume. Even this normal, large, or small volume. Small volume is due to aortic stenosis, bleeding, dehydration, and shock. Large volume is due to aortic regurgitation, anemia, pregnancy, thyrotoxicosis. The character. Normally pulse have no special character. Where the pulse have character, the pulse is abnormal, including collapsing pulse, pulsus alternus, paradoxical pulse, collapsing pulse. Method. It's examined by putting the palm of the hand of the examiner on the radial artery of the patient as grasped around it. Then we feel the pulse at normal position. Then we lift the arm of the patient upward. So if the pulse increase, it is collapsing pulse. Some causes: aortic incompetence, arteriovenous shunt. Note: collapsing pulse should be done in high volume pulse. Pulsus alternus. It is regular and differ in volume. Example: one beat is strong and the other is weak and indicate left ventricular failure. Paradoxical pulse. This pulse disappears by deep inspiration and indicate cardiac tamponade, constrictive cardiosis, and in a severe attack of bronchial asthma. Condition of a blood vessel wall. So it is either solid, so we call this hard blood vessel as in atherosclerosis, or it is normal, we will say just palpable. Radiofemoral delay. This can be examined by placing the left hand on the radial artery and at the same time place the right hand on the femoral artery. When these two arteries does not beat at the same time, this condition called radiofemoral delay, and it can be seen in case of aortic coarctation. So when you will present the pulse at the examination, you have to mention all of these points. For example, the pulse is 70 beats per minute, regular pulse, good volume. There is no special condition, and the blood vessels just palpable, and there is no radiofemoral delay. Remember, pulse examination include radial artery, brachial artery, carotid artery, femoral artery, popliteal artery, dorsalis pedis artery, posterior tibial artery.